So today we're going to be going over joint mobilizations. We're going to do it for the glenohumeral joint, tibiofemoral, and MCP joint. To begin, why we would do joint mobs, it can be for either pain modulation or do increased tissue mobility. Grade 1 has a small amplitude, starts at the beginning of the range of motion, and is for pain modulation. Grade 2, a little bit more, so you're going to be going middle to end range, larger amplitude, and also for pain modulation. Grade 3, we're going to be doing grade 3 oscillation is going to be middle to end range. This is to increase tissue mobility, and this is to larger amplitude. Grade 4, small amplitude, it's going to be at the end range, and this is to increase tissue mobility. Athletic trainers in our scope of practice do not perform grade 5 joint mobs, so for this video I will not perform any of those, but that's basically going past end range. Alright, to begin, we'll be doing the tibiofemoral for the knee. So I like to place this under them so it helps relax their leg. We got the tibia concave moving down the femur, convex, so the slide is going to happen in the same direction. So to begin, you're going to pull their leg down with your knees, and this is going to distract, and you're going to test the range of motion for anterior and posterior. So we're going to test anterior. It's pretty good. And then posterior. So posterior, she's got a little bit more than anterior. You're going to ask the patient at any time if they feel pain. And so to begin, we're going to do grades 1 through 4, coming anterior. So once again, apply the distraction to your knees. Grade 1, nice and soft, small amplitude. Grade 2, a little bit more, larger amplitude. Grade 3, and then grade 4, end range. And she has no pain with that. So since she has no pain, we would do a grade 4 to increase tissue mobility if she was tight. So then posterior, same thing. Applying traction, but pushing back. So grade 1. Grade 2, a little bit larger amplitude, middle to end range. Or grade 2, beginning to middle. Grade 3, middle to end range. Large amplitude again. And then grade 4, full. And she had no pain with any of those. So once again, you could do grade 4 to increase tissue mobility. Next, we got the metacarpal. So for the metacarpal, what you want to do is you want to have them relax to bring their fingers down like this. And then for the metacarpal, the phalange is going to be concave, and that's moving on a convex metacarpal. And so for this reason, the slide is going to happen in the same direction again. So you stabilize metacarpal, and we're going to do this on the second digit. Stabilize here, distract, and we're going to be touching range of motion. And she does not have very good range with this. So to begin, we're going to do grades 1, 2, 3, and 4. So distract, apply superior, inferior, come down. So this is grade 1. Grade 2, we're going to do a little bit more. Grade 3.
Grade 3 hurts.
So that hurts. So because it hurts her for 3, we're not going to go to 4, but 4 would be going to the end range. So because it hurts, we could begin to start doing like grade 2 on her for a little bit, and then eventually go up to grade 3. And then once again, with all these joint mobs, we should be doing them like the oscillations for 30 seconds. Next, we're going to be doing the shoulder. So put your head down this way. And we're going to do a couple questions that we have to ask for the knee and then the metacarpal. What are the relevant amounts of force and motion for this joint? The knee, going anterior and posterior, she had very good range of motion for both of those. The metacarpal, not so much. How do they compare with those on the knee joint? Metacarpal was a lot tighter, but when it came to the knee, tibiofemoral, we had to use a lot more force to get to the end range, and that's just because you're looking at a bigger joint, the knee, as opposed to just like the second digit. Yeah. So when we started feeling resistance, I felt it for her knee going grade 3 for anterior and posterior. For her metacarpal joint, she was immediately, and I was immediately feeling it probably at grade 1. because of how tight she was. So we're gonna do shoulder, glenohumeral, anterior and posterior lats. So you're gonna come off the table a little bit more. And once again, we're gonna test like how good the range of motion is. So posterior distraction, go down, and she's good with that. Posterior, doing these posterior glides would help with flexion, and these anterior ones will help with extension. So again, have her relax, relax. You could have them just put their arm right there, and you could pull, and then apply anterior, see range. She's got pretty good range in both of those. And then with glenohumeral, you have the humerus moving on the glenoid fossa. The humerus is convex, and glenoid fossa is concave, so the slide would happen in the opposite direction as opposed to the other two. But so we're going to do posterior. So you can apply a distraction force and go down. So grade 1. Grade 2, a little bit more. Grade 3. Almost the end range, and then grade 4, finally, end range. No pain with any of those. So with her, we can do grade 4 to increase tissue mobility. She's not really lacking too much. She doesn't do too many overhead activities. She does basketball occasionally. So for this one, we did posterior, so now we're going to be doing anterior. Both of them had good range of motion, so we shouldn't have any problems. So I'm going to apply traction. And go up. So this is grade 1, barely movement. Grade 2, a little bit more. So middle range, grade 3, middle to end range, and then grade 4, small amplitude at the end range. And she had no pain with that. So we could continue doing grade 4 with her to increase tissue mobility for the future and make sure she doesn't tighten up. Couple questions. Does the resistance get greater as you move the humerus to the glenoid fossa, or does it stay at relatively the same resistance through mobilization? As we start going into more grades, there's more resistance, so resistance does get greater as you move through the humerus to the glenoid fossa. And then, how does it compare the knee and the metacarpal? Good range of motion for the shoulder, both anterior and posterior. Usually, if you have athletes or patients that are coming in and they're having overhead issues, it's because they're constantly doing those activities. She also involves a lot of stretching for flexion and extension with the shoulder, and she's been doing exercises at the gym for their deltoids and stuff like that. Yeah, so the reasoning behind us doing joint mobilizations is to either like help out with the pain or to increase tissue mobility, which we were able to do, especially with the shoulder. The metacarpal joint, she's injured it a couple times in the past, so that would explain why she doesn't have full range of motion or it hurts. So for her, we could do grades 1 and 2 in pain modulation, and then eventually move up once we reach that step. And then yeah, that's why we use joint mobs. Thank you.